Good morning, everyone. I'm Gina Sudam. I'm the president of the Wyoming County Chamber of Commerce. Welcome to all of you this morning, and thank you for joining us for our Restart, Rebound, Rebuild series. We are in our rebound segment and starting to get back to work slowly. As you all know, Governor Wolf is lifting us from the red phase into the yellow phase this Friday on May 22nd. And there's a lot of questions out there about what that might mean for all of us as business owners, as managers, as people who are working in space that is now accessible to the public. So I want to go over some of that with you. But I also have with us on the phone this morning, I have three insurance agents. I'm sure there may be more on the phone as well, but I have three that we're going to talk to this morning, and they're going to go over some important topics that are going to affect you all as we start to go back to work, but also just in the regular everyday things that we're doing. So first, I'm going to start with Tyler Emmerich, and he's going to talk to us a little bit about workers' comp insurance, because there's some big changes with workers' comp right now, and I want you all to be aware of those. So Tyler?
Thanks, Gina. Yeah, so there's quite a few topics with insurance that are changing daily, but I'm going to focus on workers' comp. I know I mentioned, geez, it must have been a couple months now. How long have we been doing these? Yeah, something like that. Lowering your payroll on your workers' comp if you're shut down or you have some people laid off. That was one of the things, or lowering your gross receipts, calling your agent, and that could help with your premium. Well, now things have evolved a little bit, and workers' comp now, there was a filing just recently that passed that I guess the most straightforward thing to say is if you have someone that's furloughed and you're paying them still, whether you have a PPP loan or whatever the case may be, they are going to exclude those wages from the premium. You do have to document it. You have to make sure that you're documenting. I'm paying this person. I don't know if you want to set up another account on your QuickBooks or whatever you're using, but it has to be clear documentation that the person is not working, and they will exclude those wages. One of the examples I like to use is a school bus driver, for instance. Most of them are still getting paid right now, whether it's through the school or whatever. Let's say their rate is $4 or $5 per hundred. If you could exclude that wage, that's very substantial. So I think it hits all businesses, but if you are more of like let's say you have office people and they're working from home, they might be 20 cents on 100. So you're not talking about substantial savings there. But certain industries, it's funny, the PCRB used the example of manufacturing. I don't know why someone that would be in manufacturing is now sitting at home on a computer, but if for some reason you have that case, this hits home. PCRB is the Pennsylvania Compensation Rating Bureau. They do all the rates with workers' comp. Anyhow, I think that is probably the most important point I wanted to get across, and just call your agent, and you can save a lot of money on workers' comp right now. Even if you don't call and you just sit on it, they're going to get this in the audit. Everyone knows that when you have workers' comp, you have an audit every year. They're going to exclude those wages, but I just want to make sure people are documenting what they can and saving what they can right now. So I think that's it for me.
Great, that's really important, Tyler. I think that's important information for us all to know. And as you said, may not affect those of us who work in an office every day, and our workers' comp may not be as high as someone who is out traveling, or someone who is in a higher risk setting. But for those who are certainly, like you said, the example of the bus driver, I think is perfect, and hopefully can save those businesses some money. So, and then in the audit that you do at the end of the year, there'll be a space to kind of note that, I imagine, to say, we worked from home for these, 3 months or however long this drags out to be, right?
Yeah. Well, I was thinking more like, someone that owns a whole bunch of school buses. So
Okay.
it's not necessarily the driver that has to do this documentation.
Right.
It's the owner, and they haven't been clear about exactly what you have to say. But it just says clear documentation. I gotta believe they're going to be kind of lenient on this. Yeah, you're going to have to prove it, but it's not going to be, you know,
Sure.
hands to the fire type thing. I think as long as you have your documentation in order, just like the PPP loan stuff, everybody's wanting to know, oh, what do I document here? I think just kind of be mindful of it as long as everyone's aware.
Great. Thank you so much, Tyler. We appreciate that and the insight on workers' comp. Again, call your own insurance agent if you have questions about your specific plan. And that's going to be the same for all of the insurance agents we talked to this morning. Even though there's speaking about different topics, we want you to know that you should be calling your agent directly when you have questions regarding these topics. So next we're going to move to Matt Tabani. I think I'm saying your name right. I meant to ask you and I didn't.
You got it.
All right, good. And Matt's going to talk to us a little bit about health insurance and life insurance and what we should be looking for in that area right now.
Sure. Thanks, Gina. Two items that we're seeing through our agency, there's been a big increase in a couple of these things that were, well, I guess I'll say underutilized in the past. And number one would be telemedicine, with a lot of people not being able to set appointments in a facility with their healthcare providers. Telemedicine has been something it's been around for quite some time, but it hasn't been something that's been used all that much. But we're seeing a lot of people starting to take advantage of that. And one of the things that has helped push that along, so to speak, has been there's been a waiving of copays and things of that nature to people who are on those plans. So that can be initial appointments where you're communicating real time with a doctor or some other healthcare professional. It can be after the fact. It can be kind of the remote patient monitoring, things of that nature. That's out there that, most plans have these days. I can't guarantee everybody's health insurance plan has it, but if it's Affordable Care Act compliant, it should have it, and then or will have it. And if it's not, if it's a grandfathered plan, then I can't speak to every plan. But those are items that are out there that certainly during red phase or yellow phase, as things are closed down, people want to get stuff done. But we believe it's going to continue to be that way for a while, as comfort level is still low for some people going out and meeting with folks. So that's something that's out there that we're seeing a much larger utilization now than we have in the past. The second one is mail order prescription drugs that, again, it's not new. It's something that's been there, but people have their habits and they go to their local drugstore and usually pick up their drugs. That's again, something is much like the telemedicine we think is going to be utilized at a higher level for a period of time, maybe forever, as people get more comfortable with the Amazon method and that sort of thing. But certainly we've seen an uptick there. So that should be something you could see as available to you. Walmart, Walgreens, the big ones certainly do it, and have that ability to do that for you. One of the questions we get that we really don't have a good answer to yet is, what are the health insurance premiums going to be like down the road? And I can't say for certain what it's going to be. Obviously, if you're familiar with how insurance works, it's going to be based on utilization and claims. A lot of the insurance companies are taking on a lot of the bill for the testing that's out there for the coronavirus. That's not, that the consumer's not seeing a charge for. So that's reducing some of the reserves that they have available. So it's tough to say exactly what that's going to look like. There is reason to think that we're going to see some increases down the road with the health insurance premiums. That's not really new either. I mean, we see that all the time where the premiums increase. Obviously, as you guys already alluded to, talking to your agent and having them do the legwork for you on that is, shopping it. You might be with Blue Cross Blue Shield, what is Geisinger offering, what's UPMC offering, and the options that are out there. And obviously that's something that can help keep those costs in line. From the life insurance side, we're actually seeing a lot of activity in our agency with life insurance recently. A lot of people are putting in applications. Not to put too negative a spin on it, but when you're hearing about death every day in the news, I mean, I guess people are thinking about it a little bit more. But we're seeing some changes with companies. If life insurance is on your mind, we're seeing some restrictions in the products that they're offering right now. We're seeing people, or underwriters, I should say, taking a closer look at travel history and travel habits. So where are people going? In the past, that's generally been, as long as you don't go to some third world country, you're fine. Now it's, well, even if you've been to Italy, that's a problem these days, that kind of thing. So, so that's something that's out there. On the positive side, we are seeing that a lot of companies are trying to give you increased options that do not have medical exams tied to them. There's a comfort level with both the examiner and the client that, yeah, then I don't know if I want somebody in my home. I don't know if I want to go to their home to have the exam done. So we are seeing some companies that are expanding what they will offer without having to go through the medical exam. For the applications that are in, we are seeing a longer turnaround time to get exams done for the reasons I just talked about. We're getting medical records as some of the medical providers have, closed down some of their staff, furloughed some of their staff, that sort of thing. But they're still open for business. So we are seeing a lot of people that are interested on that front.
Great. I think it's all very helpful information right now. And again, knowing what your options are and talking with your own agent about those options, I think is very important right now. Susan Kelly is here. She is with Welsh Insurance Associates. And Susan's going to talk a little bit about business interruption insurance. And this is something that when all of this started, everyone called their agent and said, well, I have this. I know I have this business interruption insurance and it should help me, right, Susan? And so we're hoping that there's been some movement on how this part of your plan can and will help us maybe going forward.
Good morning, everybody. Thanks, Gina. Yes, unfortunately, this was trigger number one that we received calls on, and rightfully so. And unfortunately, in business income, loss is what it is. It's a loss as a result of, it's a reduction in your revenues as a result of a claim. Typically, that's a result from a fire loss, your more typical wind loss, anything that's preventing you from operating your business. Unfortunately, virus is a standard exclusion on all policies. We actually have a good handful of policies that we do have communicable disease endorsed on the policies. That's more particular to social service agencies, camps, schools. However, even on those accounts, the virus would have had to occur primarily on their premise for coverage to be triggered, and that's simply not the case. So what we have counseled our clients is exactly that. There's no coverage. However, if you're not comfortable with that, because there is a lot of contradictory information in the marketplace right now, there's legislation that's been filed. If you're not comfortable with just there's no coverage, file a formal claim with your agent or your carrier. Let them formally decline it. And you did your due diligence. I don't think that's necessary to do in order for coverage to potentially respond in the future if legislation does indeed pass. However, that could take a very long time. And in our opinion, any type of coverage is going to have to be a creative effort by the government and the insurance companies to be able to respond, because the insurance companies just could not respond to this type of loss. They're not prepared for that, and they didn't rate for it. So that's what we would suggest from the business interruption side. And going forward with, I know you're primarily going to be speaking going into the yellow phase. The only caution we would put out there is, there's communicable disease exclusions on general liability as well. So the insurance commissioner had sent out a directive a week ago to those businesses that choose not to follow the directive during the yellow phase. There are standard exclusions in every policy with regards to illegal conduct. So if you did have a claim and you're operating against the initiative of the yellow phase, there is a possibility that claim would be denied. So I think it's important for everybody to be aware of that.
Thank you.
Other than the business interruption, other areas that we would, encourage every employer to look at, and we've been over the last 2 months, is your cyber liability exposure with your employees working from home. That's excluded on general liability policies. There's standard standalone policies that can address the needs there, and that's important. As well as employment practices liability for employers. We may have to initiate some procedures bringing our employees back they may not appreciate, and that can result in employment type claims. So if you don't have employment practices liability coverage, it's something you may want to look into. So there's a variety of issues we can look at, but in terms of what we were focusing on today, that is what we would recommend at this point.
Great. And I think those are two very important things. I wrote both of those down. As you know, the chamber is operating all from home right now, and we are doing a lot of cyber communication, obviously this and other things out to our members. So I want to make sure that whatever we are putting out there, we're covered to do. So thank you very much for those two pieces. And that's going to bring us to our next discussion. And what I want to talk about now is really moving into this yellow phase, what it means, and what you should be doing as a business to prepare yourself and also protect yourself. So the governor has put out an order. He did that several months ago, an order regarding business safety procedures and what it means to reopen your business to the public. But most importantly, the health department created a COVID safety procedures for businesses document. And this is much like the Department of Health documents that you'll see hung in your business, the labor documents that you will see hung in businesses. And what they're asking us to do, and I'm going to share my screen in just a moment so I can show it to all of you, but what they're asking businesses to do who are going to reopen to their employees and have customers or the public coming in and out would be to print, sign, and display this signage where not only your employees can see it, but also somewhere where your customers can see a copy. We want our customers to know that we are taking every precaution that we can to protect them. So I think it's important that we sign these things and have them ready. I'm going to share my screen, which is just going to take me a moment. So I put this up on our chamber page on Friday. Last Friday when the governor announced that we would be moving into the yellow phase. This is found on the Department of Economic and Community Development website for the state. And you could read the governor's full guidance here if you'd like to do that. But more importantly, this is the document that you need to read, understand, and then sign. It also asks you to assign someone, probably in management, to be the pandemic safety officer. This is the person who will answer any questions from your employees and your subcontractors regarding these requirements. To me, this is also the person who is going to be responsible within your business when it will be time for contact tracing, if that should happen to your business. For us at the chamber, we do plan to hold open our office by appointment only. So we will not have more than 2 or 3 people in the office at a time from outside. We don't plan to do board meetings in the office. for a while, we can obviously accomplish those remotely. And if you need to see us at the chamber, again, we would ask that you make an appointment. Those things I have documented, and I'd be happy to share that documentation with anyone who's looking to kind of create their own plan. But one of the things I really want to touch on this morning, because I'm seeing a lot of pushback about this locally, is that that mask piece. So you must provide your employees or ask them to wear a mask at all times. You should be asking your customers, or requiring, again here it says require customers to wear a mask or a face covering at all times when they're in your business. Limit checkout. And then the in-person meeting piece, limit those in-person meetings to 10 and remain 6 feet apart. So this is a tough thing to accomplish in small space. So we want to make sure that you're aware of this. There are also pieces that I've seen documentation where it does open the social settings to larger gatherings, but I want to make sure that people understand for business practices that should only really be 10 people, and in a social setting as well as in business practices, you should be still maintaining that social distance piece. I want to answer questions this morning more so than continue to talk at you, because I think there are a lot of questions out there in the community. So you can use your chat feature, or you can simply unmute yourselves to ask questions about this piece or any questions that might be coming up for you. Let me stop sharing my screen so I can see all of you. Okay. Okay, so what one of the things that's being mentioned in the chat is to not dissuade customers away from a local business. Certainly, I'm not saying that you should deny your customers to enter your business, but what I'm saying is you have a responsibility as a business owner to keep not only yourself, but your customers, as well as your employees safe. And that's what I'm promoting here as a advocate for our business community. The worst part about this could be that we open in the yellow phase and then take a step back into the red phase. And I think you'd all agree with me that that's not where we want to be. Again, I understand the Walmart and the Weiss it being open, and that's a struggle for small businesses as well. But you're all open and you're all able to work. Weiss and Walmart provide food, and that was part of the governor's initiative to leave those spaces open, was my understanding. Yes, I very much, hate the fact that we couldn't shop local through this, but I think that now we need to look at the positives and look at how we can move forward. Another question that we're getting is, are there restrictions or rules on taking temperatures of employees and customers? Again, this documentation that I just shared only says that if there is an exposure within your building, you should take each employee's temperature before they enter the building and send them home for those that have a temperature of 100.4 or higher. And that's kind of on an ongoing basis, that you should be taking their temperatures if there is an exposure within the building. It is good practice. It has been recommended that you ask your employees to kind of do a self-check every morning before they come in, to check their temperature and to kind of log that they are that they've checked their temperature and that they're feeling fine. I know some larger businesses are checking them on site. Brad, I don't want to put you on the spot. I know that Procter & Gamble, as a large manufacturer, they are checking them every morning when their employees come in. Brad, are you relying on your employees to check their own temperatures, or are you checking them on site?
We have not started temperature checking at this point. It's something we have a reserve. And then, as you mentioned, Gina, if in fact we do have a situation where it's required, then we'll start. But we're ready to do it. We just haven't pulled the trigger yet.
Okay, great. And I don't think it's necessarily, I don't think it's necessarily important for all businesses to start that right up front. I think it's important for businesses to have a procedure in place that if they start to suspect customers or their employees are ill, that they do begin to take temperatures. I'm sorry, I'm trying to read the chat as well. So a question just came in. I know that Wyoming County is at the threshold of entering the yellow phase, but is there any state guidance for patrons or employees yet for businesses who can't open till the green phase? I have not seen too much information, although I can say on the Bringing PA Back website, which we went over last week, there is documentation. I'm just taking a quick look at it. There is documentation for large gathering spaces. I just saw that this weekend. It's called Amusement Park and Attractions. So plans suggested for opening commercial recreation attractions. So that might be something you want to look at if it is a large, and I think that question was brought up by Erica. So I imagine, looking at the entertainment industry, what are your options there? Again, that bringingpaback.com website is a great tool to get everything all in one place. So they have guidance for the construction industry, the restaurant and lodging industry, retail food stores, manufacturing, bed and breakfast, childcare guidelines, and then again, those amusement park and attractions. So I think it's important to kind of know what resources are out there. Call the chamber and ask if you ever have any questions. While we aren't physically at the office, that chamber phone number, 570-836-7755, is ringing directly to my phone number, my cell phone right now. So you can call me and I will find you the guidance if it's not readily available on our website. But most of the guidance is available on our website, and that's wyccc.com. Again, we took a little bit of a different approach this morning with our retail segment of this. And I wanted to do that because I wanted to give you time to ask your questions. So I didn't get a lot upfront questions, which I normally do. So I was a little surprised by that. And I just wanted to make sure that I had time to answer any questions or things that you might be facing as you reopen. Without seeing any or hearing any questions, I don't want to keep you any longer than we have to. Again, I encourage you that—
I have a question.
Sure.
Is there anything in the legislation or coming out of the healthcare industry that prevents a retailer, and this might be an insurance question as well, a retailer or a customer holding somebody liable if they get COVID or coronavirus while they're on premises as an employee, or it's suggested that an employee was sick and a customer got it that frequented that establishment that's opening? As long as we're following protocol and disinfecting and cleaning and so forth, according to my experts, it's very difficult to kill coronavirus, and it can stay active in an 11-day process if it's not using an EPA registered chemical to kill it, and preventative programs to do that. So I'm wondering what's out there, the liability aspect, so everybody's comfortable that they're not going to be held liable if we spill hot coffee on somebody.
Sure. Well, I can tell you that the Pennsylvania Chamber is pushing for protection for businesses with liability against this. However, it's not there yet. The thing is, it's hard to prove, right? So it's hard to prove that I walked into XYZ store and got COVID because I was there. And that is kind of, I guess would be some. I'm going to defer a little bit to either of the insurance agents. You both unmuted your phone, so
I was going to say, I don't know if there's an attorney on here because workers' comp, I mean, he mentioned employees. Yeah, if they get sick here, it's going to be covered under workers' comp, but how you going to, I mean, proving it is the problem. And I'd like to hear what an attorney would have to say if there is one on here. Maybe Susan, I don't know. Matt?
I'm not an attorney, but I would suggest, I mean, obviously the healthcare industry is going to be struggling with this from a workers' compensation standpoint. And we've actually had 1 or 2 claims filed in our office with regards to a client being infected on somebody's premise. So we're curious to see how that plays out, because it all does. One, as I mentioned earlier, there is a communicable disease exclusion on general liability policies. And 2, how could it be proven? So I think legislation, Richard, going back to your question, it's evolving daily. Right now, I would tell you insurance policies are geared to deny, on the workers' compensation standpoint, diseases of ordinary life are typically excluded, but we're in new times. And I just think a lot is yet to come. And that's why we just need to follow the guidelines to make sure we're protecting ourselves as business owners as well.
Yeah, I think there's another issue too, and I'm not trying to paint a negative picture. I think it's great and positive that we're moving forward, but if we're not trained properly with the disinfectant aspect and the quantity and use of alcohol-based hand cleaners, we could have some long-term disability issues come up with employees using a bad formula of Clorox, which doesn't kill coronavirus, with lung issues and allergy issues tied to the alcohol-based antiseptics.
Right.
Or hand cleaners. So that's something else that is important as an employer, that we teach our employees, especially the pandemic manager, proper procedures and follow specific guidelines, and don't overdo our exposure to the gases that could come up from Clorox and hydrogen peroxide.
Right. So again, there are great resources on that Bringing Back PA on proper formulas for your cleaning supplies. And also, Richard, I would tell you the Bringing Back PA website also has a public policy section. So you can see in there all of the legislation that they are looking at right now and encouraging members to support. So I would take a look at that. There is a large section about employer and workforce and education. So I'd take a look at those pieces.
Yeah, no, I've seen that. I'm bringing up these points more for the benefit of the owners. I'm sitting on boards right now with the American Hospital Association,
Right.
disinfected organizations around the United States, EPA registered and CDC registered components, as well as the American Nurses Organization. So we're pretty involved with the PPE industry as well, but it's more of a concern, just everybody needs to address it. It's not something we want to overshadow or simplify.
Sure.
At least follow the procedures up front, and hopefully we get rid of this problem and create the new normal and create the new protocols that are responsible for protecting everybody. as well as the business owner and their employees.
Well, I certainly agree. So one of the things that I think we are going to do, yes, I will post the Bringing Back PA website on the WYCCC website as well. So it's right there and readily available to you. It is out there right now with our talk that we had with the PA Chamber about that website specifically. On Friday, we have a new tool that I want to introduce to all of you, and it's a way for you, it's going to be a way for you to talk directly with the experts in a smaller setting than this. So right now we're looking at about 40 people on this call, and I realize it might be intimidating for some that have questions that they feel are silly, or they feel they don't necessarily want to ask in a large group setting. So what I would encourage you to do is watch your emails for Friday's call. Kind of bear with us. What we're going to do is set up Friday's call in a setting where you'll be sitting with 5 other people and having a Zoom call, or what will look like a Zoom call with 5 other people. One of those people will be an expert in an industry topic that we have already covered, whether that is PPP or EIDL or insurance. We're going to be asking these experts throughout this week to join us on that call, and then you'll come in and sit at a table with a topic that you are interested in discussing, and then you'll have the opportunity to move and sit at a different table and talk to those different industry expert or a different industry. So I'm very excited about the new tool, but it is limited space. So we are limited to 50 participants on Friday. What we will do is we will hope to open this up and have more participants in the future and do a larger call of this format if our Friday call goes well. But we did limit it to 50. So if you're interested in getting on that call and talking directly with an expert, please register for that today. We look forward to Wednesday's call, and Wednesday, I believe we're discussing rebounding your brand. So how do you bring your business back after you've been closed for so long? And also in industries that mean changing everything you've been doing, right? So the chamber industry certainly has changed a lot, and we're going to start considering what it looks like for us going forward. And I want you to all be thinking about that as well. So we will talk more about that topic on Wednesday. Again, you can register for both of those calls at wyccc.com. I'd like to thank Matt and Susan and Tyler for speaking with us this morning. We truly appreciate your insights, and please call your own insurance agent and ask them those questions about your policies, because it is important that you're taking a proactive approach to getting your business back in shape and ready to rebound. Thank you so much, and have a great day, everyone. Bye.
Thank you.